Hi. Um, I wanted to tell you a little bit about Myasthenia Gravis, which I've had maybe since 1993, certainly since the year 2000. It's a little known disease, quite rare. It doesn't have a cure, although there are drugs that help it and control it. I was told by the first consultant I saw that it needs to be treated with respect, and I didn't realise at the time how true that was. So I give this video for potential patients or their relatives and maybe even the medical profession, so that they have an idea of how it develops and what it's like. But just very basically, the myasthenia gravis is a situation where the message from the brain to the muscles is interrupted. So the voluntary muscles are affected. It's not a case that it's a progressive disease that, where you gradually become worse and worse and worse and become ill and then you die. It can be controlled. It's just that these messages to the voluntary muscles, which are like speaking, breathing, use of the eyelids, moving your hands and arms and legs and this sort of thing, are all voluntary. It can affect the swallowing, and it did with mine significantly. It can affect the bowels and the bladder. It did mine slightly, but usually that's a particular type of myasthenia gravis. There's a couple of different types. In 1993, I was under quite a bit of stress, and I had this very bad headache one night, and then in the next morning I was numbed down the whole of the left side of my body, including my tongue. Now, and it wore, and I thought my voice, it was like I'd been to the dentist. I thought my voice was slurred, but it wasn't. But I could feel, and it affected my bowels as well, because it seemed numb around the area. So I thought at the time that it was like what they call a mini stroke. But I recovered, and somebody sent me to a private doctor, because I was in a live-in job there then. But he said that it might have just been a viral infection or an infection or similar. So he didn't mention anything about it being a mini stroke. I had weakness in my knee for maybe up to 5 years later, so that's gone now. So I don't know what that was. It may have been the beginning of the myasthenia. I don't know. So that was that. And then in the year 2000, again, I was under a lot of stress at work. I had quite a lot of responsibility at this particular moment, and a lot of things were going wrong. And I noticed that I was almost having trouble swallowing. I couldn't. It was sort of. I got it into my throat where I felt that I should be able to swallow, but somehow it wouldn't. As normal, as easily as before. Anyway, it wasn't too bad, so I was still able to eat and that sort of thing, and I didn't think too much of it. I don't know, I didn't like going to the doctor then. So that passed, and the stress passed as well, so maybe that had something to do with it. And then in, I think it was 2001, I had problems with my eyelid. I could notice that it was getting dark. It seemed to be getting dark. And then somebody mentioned to me, your eyelid's drooping. So anyway, that passed as well after a few weeks. And then in 2006, again, I was under a lot of stress, and it was very hot because myasthenia gravis is affected by the heat as well. If you have it, it may make it worse. And it was for my aunt's 90th birthday. And during that time, my eyelid was very bad, drooping. I had to hold it open in order to, like this, to keep it open. So again, that passed after about a month, after the heat had gone and the stress was over. So you probably say, why didn't I go to the doctor? But I just didn't like doctors then, and I also believed in healing and Christianity and that sort of thing. So I was relying on that to an extent, but I didn't like going to doctors. And then in 2000, so that got better. And then in 2009, I had changed I'd taken a couple of years off to write a book or 2 books, and I'd run out of money, and I was about to start a new job, and a week before I was due to start, I had this very I've been feeling sort of generally unwell also, and I was having trouble with my bowels and my bladder, and was bladder incontinent slightly before this, so I didn't feel 100%. And so as I say, normally the Myasthenia Gravis that I have, or most people get, doesn't involve the bladder and bowels, but maybe there's no strict rule, I don't know on this. Anyway, that's what happened to me. And and I was also getting swollen areas on my leg and on the top of my foot and on my arm, and it would be tender and be swollen for maybe 3 or 4 days, and then it would go away. Anyway, by this time I was getting quite worried, so I did a Google search then, and I typed in my symptoms, and Myasthenia Gravis came up with this list. And when it mentioned this, that it was also connected to rheumatoid arthritis, and plus the issue with the swallowing and the eyelid, I thought that is probably what I had. So I went to the GP, and I said, look, I think this is what I've got. Can I have this test? Because there's something called the acetylcholine receptor and antibody, which they take a blood test, and it usually Myasthenia Gravis patients have. It doesn't always show up, but with me it did, fortunately. So the GP at the time, wasn't too keen on the thought that that's what it was. He said, well, that's a interesting idea, but anyway, he did it for me, thank goodness, and I thank him for that, because it is difficult to diagnose. And the results came back, and then he referred me to a consultant, who was the one that said that you have to treat Myasthenia Gravis with respect. But I didn't realise at that time what could happen. He said to me that there are 2 ways of dealing it. You can deal with the source of the problem, which really means you have steroids, and you sort of suppress the immune system, because it's an autoimmune disease. So as is multiple sclerosis and a number of other diseases, well-known diseases. So, and autoimmune really means, it was explained to me where your own body is fighting against your own system, really. So, so the consultant said that we could deal with with steroids or similar. But he says there's another drug that you can have, which will just deal with symptoms, which was pyristigmine or comestinon, also it's called, which just helps it's a drug that helps those messages to get through to the brain and the muscles. No, they don't always work that well. They do help a bit, and it varies, I think. They can also give you diarrhea, and they cause a lot of saliva in your mouth, a couple of other side effects, but they were the ones that affected me. Anyway, I said I didn't want to take anything. Because when I had this, before I went to the GP and I had this, was about to go for the job, my voice started slurring as well, my speech, so I couldn't speak properly. And also, I had this very intense nausea in my throat, not in my stomach, but in my throat. So I went to the consultant, and I said, look, I don't want to take any drugs, really. So he said, okay, fine with it. Anyway, then I applied for another job, which was, I had been a nurse in the past, and I've been working in property letting and management in the past as well. So although the slurring of my voice had improved a little, so I got this other job, and they knew that I'd got the Myasthenia Gravis, but they accepted it. But within the space of 6 weeks, I'd had a cold and lost my voice, and then another few weeks passed by, and I was getting week on week. I couldn't throw. It was like housekeeping as well as looking after their property and a couple of other properties, and they would go away and leave me there. So and I couldn't. They had these very large bins, and I couldn't hold the lid open and throw the rubbish in at the same time because my arms were too weak. I had to. I couldn't hold my head up. It would droop like this, and I'd have to hold it up like this, or I'd have to tip it back so that it would sit back. But then, as soon as it went down a little, it would droop down like this. So it was very difficult to do that. So work. Anyway, I was hoping it would all pass, and I still managed to do the work. But then I got swine flu and pneumonia. While I was there, I spent a very difficult night where I couldn't breathe really very well, and then I called an ambulance in the end, and they took me into hospital and tried to resolve it with one of these, looks like a space helmet with the oxygen, where you have the oxygen in there, but that was making me cough because somehow it dried my throat. And anyway, I asked them to take it off, and then I couldn't breathe because it was like this. I think because of the pneumonia, you get water in your lungs, really. And so they sedated me, and I was put in sedation for about 10 days, all over Christmas. This was a New Year, 2009-10, and I didn't really know much of what was going on there. When I woke up, I had a nasogastric tube in because I couldn't swallow, or I presume they couldn't feed me, so they had to put that in anyway. But they wanted me to. We tried taking sipping water later on as I got a bit better, but I would just cough. It would go down the wrong way. Because I couldn't swallow, because the swallowing muscles are a voluntary muscle. So they put me on steroids and gradually raised, I think it was 60 milligrams, then they tried 70 milligrams, and I found this was making my tongue and in a mouth swell somehow, and I thought was making the swallowing even worse. So I asked if they could put it down to 60 milligrams again. Again, I was very much against medication and that sort of thing. They said would take a fortnight to take effect, but after 4 months, still I had made no improvement. I still couldn't eat really, maybe a slight improvement. But I felt I wanted to get back to London because I was in Eastbourne at this time, and so they'd got me on 60 milligrams of steroids then, but I felt that as the steroids hadn't worked for me, that I thought maybe that they weren't going to work anyway. And so I believed in healing, as I mentioned, so this was sort of interacting with the decisions I probably should have been making. And was so very, even though I'd been a nurse, I was so very against taking medication. So anyway, I asked if they would discharge me, which they did, although the consultant at the same time said that he, would have, my present situation at that time, he would have been admitting me to hospital, not discharging me. Anyway, he discharged me, and I thought that I stayed with a friend in London, but I just got worse and worse because I found I had been eating a little, but they'd taken the nasogastric tube out. So as I tried to eat, I was trying mashed banana and take my drugs in the morning with the initially, but over this process of maybe 6 weeks again, I couldn't take my drugs, couldn't even take the steroids, which are essential, because with steroids you cannot suddenly stop them, you have to reduce them gradually. And I had been reducing them under the GP in London, because he agreed that we could try doing that, because I thought perhaps the steroids were affecting me, causing me not to get better. So my weight went down to 6 stone, and then this particular morning I couldn't take my steroids even. and I'd had a lot of trouble. I had to sit up in the night because this my saliva I couldn't swallow even, and this was quite difficult time really. So we went to A&E and they put a nasogastric tube down into my stomach again so I could have nutrition, and had the nasogastric tube in for 18 months. And 6 of those 18 months I had what they call a peg tube into my stomach, which went, instead of it going down my nose, it was I had a operation under local anaesthetic where they sort of puncture a hole into the stomach and put this peg tube in, and then the feed that usually links to the nasogastric tube is linked to the tube that goes directly to your stomach. So this gives it is easier on the nose, and you don't have to have the nasogastric tube changed every 3 months, which is not, I used to dread it. It wasn't that bad, but sometimes it was okay and sometimes it wasn't very good. But even the peg tube wasn't terribly successful because I had an infection in it for most of the time, and this didn't go away. Fortunately, the drugs eventually started working, and then they removed the peg tube, and they say it only should take they can heal up very quickly, like within hours, but mine took about a week, I think, before it healed up. But again, I was on immune suppressants, so this hinders the healing. It was a case that I didn't really like the thought of these tubes anyway, and I looked into it and found that there are different types. So I asked if I could have this one where the stomach is punctured from the outside, because although it was quite painful at the time, I preferred that. I don't know how. I do believe it's quite common that you get an infection from these, so I don't know whether it's best really to have nasogastric tubes ad infinitum. It's one of these situations you're caught between the devil and the deep blue sea, really. There's no clear way that seems right or pleasant. And a lot of these things are not as unpleasant as you imagine. We imagine them worse than what they are sometimes, but, they are what they are. When I was in intensive care, again, and I was on a ventilator again, and I was in intensive care for about 3 or 4 weeks, I think, and that was a very difficult time as well, because they couldn't put the nasogastric tube down, and so they gave me this neostigmine, which is similar to pyristigmine but stronger. And that had quite a dramatic effect on me, but it did allow me to swallow, and but it also then caused me to go into urinary retention, so they then had to put a catheter in because I couldn't pass urine. So they put me into ITU again as the second time, and they gave me a very high dose of steroids, starting at 60 milligrams this was, and I was having that daily. They wanted to have my thymus removed, because with the thymus is often part of the problem, they think, but they're not 100% sure, but they find if the thymus is removed, it helps considerably. Mine did have a benign tumour in it, I believe, which is why they felt it was affecting me more specifically. They wanted me to have it during this year when I was recently out of ITU, but I was rather frightened about that because I just didn't feel well, so I refused that again. But anyway, by January of the following year, which was about 2011, I think, because I was having so many problems, I used to have to carry a polythene bag and a box of tissues with me because I just couldn't swallow my saliva at all. I was walking around and I had the nasogastric tube in and would have the feed at home, and sort of looked after myself, but with the nasogastric tube in still, and I had to monitor that, and that had to be changed every 3 months, which I hated. Although in fact sometimes the nasogastric tube can be put down very easily, without any problems. So there's a knack to it, and maybe it just depends on your situation as well. But as a nurse, I had to put one down, and I used to think what a horrible thing it was. But it's not as horrible as you think. But it isn't something I look forward to. So it doesn't necessarily make you feel nauseated or anything like that. It's more a case of if it goes, as you put it down, it tends to make you cough if it's going into the area where it leads to the lung rather than to the stomach. So I wouldn't be too frightened about it if you have to have that. So I had the thyroidectomy while I had the nasogastric tube in the January of 2012, I think it was, and I was still on the high dose of steroids, although we had been, again, probably due to my insistence that I wanted to get off them and I didn't think they were doing anything, we would reduce them to see if we'd have them from 60 milligrams daily, and then we would reduce them so that we got it down to maybe 20 milligrams daily. But then as soon as I would hit 19 milligrams daily, I would start getting symptoms again. So we'd have to put it up to the higher dose again. So I think we did this several times. Anyway, then I had the thyroidectomy, and we reached the stage when the nasogastric tube was taken out. I think because the steroids had started working, partly because I'd allowed the higher dose for a longer period, because I then realised when they say that steroids may take about 3 months before they start having an effect, and because I kept wanting them to be reduced or didn't want them at all, I wasn't allowing that time for the steroids to work. So you do need probably 3 months, maybe even 4 months, to give them time to actually work. But everybody is different, and maybe some people have side effects to steroids or similar. So we're all different, really. But I would advocate, though, that we cannot rely on prayer necessarily, that you do, unless you're suddenly healed and you know you're healed, you don't mess about with your health in this issue. I thought I wasn't messing about because as far as I could see, the steroids weren't working anyway, so I thought, well, maybe let me try trusting in God and in prayer. But obviously I was interfering with the drug dose, really. I was sort of fairly okay. I was on 19 milligrams of steroids because my hope was control the Myasthenia Gravis with the steroids, so that I didn't have to take another drug, because they wanted me to take another one, azathioprine. Even in 2009-10, they wanted me to take that and the steroids, and I felt that was an incredible amount of drugs for me, and I didn't like the thought of that. With the use of the steroids, that we did eventually control the myasthenia, coupled with probably the removal of the thymus, and I was eating, but I was still on 90 milligrams, and then I tried bringing it down to 15 milligrams, and then I would find that I wouldn't always be able to swallow properly. Somehow it would be okay around 18-90 milligrams anyway, but it wasn't really fully under control. And then I started having a stressful situation again, because I was testing to see whether I'd be able to go back to work, and then as I say, I was in a stressful situation again, and then suddenly I couldn't walk, and I had this slurred voice again, and I was beginning not to swallow again, and I also couldn't hold my head up again. So again I went to A&E and was in ITU again, because I couldn't breathe nor eat, and I had a nasogastric tube in again. So that happened for about 2 or 3 weeks, and by this time it was a case that I had to go on this azathioprine. There are other drugs that are often used which are similar. They also have side effects, but I'm 64 now, but it is a case that you are sometimes between the devil and the deep blue sea. If you want to get well, you're going to have to take a risk with the drugs that we're offered. And if I hadn't have done that, I wouldn't be sitting here now, I don't think. Certainly not being able to eat, walk and talk. So the azathioprine takes maybe up to a year before it works. So I started that in 2014, and then in the space of, I think I was on that for about a year, and then they started reducing the steroids again. And that was going well. So I came out of ITU and was eating again. We moved the nasogastric tube. I did have a bit of a hiccup because I got a urine infection, and then I think the drug that they used on that agitated the myasthenia gravis as well, because there's a number of antibiotics and muscle relaxants and other drugs that you cannot use with myasthenia gravis because it aggravates it and can trigger a crisis. Now, a myasthenia gravis crisis is when something happens either through stress or an infection or similar, and then you will have all the symptoms or some of the symptoms that you often get, or some new ones maybe, and you start unraveling, as I call it. So again, like me, I can't swallow, my eyelid droops, my head droops, I can't walk sometimes properly, and my voice becomes slurred. So I went on to the azathioprine, and then after about a year we started reducing, or the consultant started reducing the steroids, and this time we managed to get them down to 7.5 milligrams, and because ideally they like to get you off the steroids altogether, because they do affect steroids over a long period can affect your bones, they can affect give you diabetes, they can give you problems with the eyes, cataracts in the eyes. Well, in 2014, I think, or it might have been 2012, I can't remember now, I was gradually getting a fog in both of my eyes, where it's like peering through a fog, and I couldn't see where I was going nor see the people's faces, and because of the steroids. So I've had both cataracts removed in both eyes. I'm borderline diabetes, so I haven't got it yet, but I'm just like a point below it. So again, I have to be careful with that. But I am on 7.5 milligrams at the moment of steroids, and 100 milligrams of azathioprine. Now, they like to 7 milligrams is around the normal amount of steroids that we have, that we produce in our own body, and so ideally they wanted to get me to maybe 1 milligram at least, but I went down to 5 milligrams, and we held it there. The neurologist held it there for maybe 6 months, and we were just about to, it was the 5th to 6th month that arrived, where I was due to see him, and we were going to try and put it down further. And then I had a cold, and then I had problems, my stomach was upset, and then I had this swollen legs, badly swollen legs, and it started with my ankle, and then it crept up to my thighs, and then my abdominal area. And I happened to go in to see the neurologist while this was happening, and he did a urine test and a blood test, and then I had a call the next day asking me to come in to the hospital urgently. So they called me in because I had very high potassium levels in my blood. Then I was taken into A&E, and then into ITU, and then transferred to a renal hospital, and had a kidney biopsy, and it was found that I had renal failure, and minimal change disease, so which is sort of related to myasthenia gravis, but not directly, because myasthenia doesn't usually affect the kidneys. But I've been told that I have a tendency towards autoimmune disease. So, and with the minimal change disease, I think it's a case that this is normally, usually occurs in children, and if it occurs in adults, then the medical profession are advised to look for some alternative reason. One of those alternative reasons is Myasthenia Gravis. So it's sort of linked, but it's not, I don't think it's usual, but this happened to me, so I'm just telling you so that, you know, maybe if this happens to you, you might realise that it might be something to do with the myasthenia. So then I was in the renal unit for a period, and again I was given 60 milligrams of steroids in order to control this, and I was in a space of about 4 weeks. My swelling of my legs had been reduced through a combination of drugs, the steroids and diuretics, which take away the fluid in your body. And we gradually reduced the steroids from 60 milligrams down to what I'm now on, which is 7.5 milligrams. Now I'm a little bit frightened to put the steroids down to 5 milligrams in case the same thing happens again with my kidneys. So again, I'm in the devil and the deep blue sea, because ideally it's the case that I am fairly stable now, but there is some talk of taking me off the azathioprine and the steroids, and I would love to get off drugs, but having been so far against drugs and going to doctors and that sort of thing, now that I'm on them and I'm well because of them, I don't want to come off them because I'm frightened that I might have a relapse, because both the kidney disease may return and obviously the myasthenia may return, although I have read that once I've had the thymus removed, that helps, and after maybe, I think just from 2 years onwards, but maybe 2 or 3 years onwards, having had the thymus removed, you get a benefit because the myasthenia may not be so proactive. And I think the first few years when you have myasthenia gravis, I've had mine nearly in the acute stage since 2010. Maybe its power is beginning to weaken, but I fear coming off the drugs now in case it comes back again, because now I have respect for it. But it does need treating with respect, because it starts very mildly, but if it is very related to stress. I mean, all the situations that occurred with me was related to stress. It's a case that if you get an infection, that can trigger a crisis again. Sometimes it doesn't, but it can do. If you're advised by your doctor or your consultant that you take whatever he suggests you do. As I said, I had the option of going for the root cause, which is the steroids or the azathioprine at the beginning, or the mestinon, the pyristigmine. Now, throughout the time I did use that pyristigmine, but I used to have them every 4 hours, and then when I was in a really bad state, it was every 3 hours, and that because I used to find that they might work a little bit, not a great deal, but a little bit, maybe after the first hour of taking them, and they would be at their strength maybe 2 or 3 hours afterwards, but by 4 hours they would start wearing thin. So when I was in a bad way in ITU once, I was having them every 3 hours over a 24-hour period, 60 milligrams, and that was most useful. I think a combination of that and use of the neostigmine they gave me again, because I was very bad. I was already in ITU, and they couldn't. I was getting weaker and weaker because I'd had this infection, and they gave me the neostigmine again, and that is a miraculous revival. After they'd given it to me, within a space of about 15 minutes, I was able to move my head and breathe and speak. Oh, it was wonderful, and I think obviously ITU were probably relieved as well. And after that, they gave me the 60 milligrams of mestinon every 3 hours, and they actually avoided my having to go onto a ventilator again. because they were talking about giving me a tracheostomy. I presume so that they didn't have to put me on a ventilator again. But we avoided this, and I cannot thank the staff enough for all their efforts, and for my consultant, but all my consultants, and for the young doctors. We need to treat Myasthenia Gravis with respect, and I think that's the key message I'd like to give to anybody who's dealing with Myasthenia Gravis. It can be very mild, but you don't need to play around with it like I did. So, as a final recommendation, as someone who's been dealing with Myasthenia Gravis for many years in its many crises, and also now having recovered to an extent, I would say, as the first consultant said to me, treat Myasthenia Gravis with respect. That's be it to medical people or patients. And also the MyAware charity, which is www.myaware.org, myaware.org, is very good both for patients, relatives, and the medical profession, because it does give lists of drugs that are known to aggravate Myasthenia Gravis, and is useful for the current research, and it gives the support lines for those issues with benefits they need to obtain and this sort of thing. And also to say again, don't mess around with your drugs. If you are getting Myasthenia Gravis symptoms, don't refuse the drugs, take them. They're not as bad as what you think, or as what we think, or what I thought anyway. Eventually I was lucky from the point of view that I didn't get major complications with any of them. If you go online, you hear some people that have suffered badly because they had a reaction to them. I think that's probably quite unusual, and the issue is if you don't take the drugs, what happened to me will happen to you. So if we go with the flow, it's best to take the drugs that are going to control it, as well as the consultant is advising you along the lines that you should do, because maybe you just need the ones dealing with the symptoms. You might be able to get by with that, but ultimately to have it controlled by a stronger drug does give a quality of life again, but each person is different, and each Myasthenia Gravis is different. Mine turned out to be rather extreme, but I'm here still and have a quality of life. So don't fear anything. Try and be bold, be optimistic, because it can be controlled and you can have a reasonable life, and we can live the full lifespan. So if we look after ourselves and know what it is we're dealing with, then we learn to control it ourselves, and know the warning signs, and can have these intercepted if we find we are going to start deteriorating. So if you have it, I wish you luck and good health, and take care.